It's Thursday, March 19. This is the news on PBCJ. I am Simone Absalom. Jamaica has experienced its first death resulting from the coronavirus. Chief Medical Officer in the Ministry of Health and Wellness, Dr. Jacqueline Mackenzie, told journalists at a press conference at Jamaica House in St. Andrew last evening that the man who was staying in Cornpeace, Clarendon, tested positive for the virus yesterday and died shortly after.
This is a 79-year-old male from Clarendon with a travel history from New York. He is known to have diabetes and hypertension. He presented to the Lionel Town Hospital on the 16th of March with fever, cough, and shortness of breath. And that time he was noted to be critically ill and was transferred to the Mandeville Public General Hospital, where he was isolated and treated. The patient had shown some improvement yesterday, March 17th, but today his condition started to deteriorate. His test came back positive today for COVID-19. He continued to deteriorate today, and during the process of transferring him to the University Hospital of the West Indies, before he was able to leave the Mandeville Public General Hospital, he demised at approximately 3 p.m. The family has been informed, and the public health team are currently on the ground, both at the home and at the hospital, to put in all the necessary efforts to make sure that we contain this possible source of infection.
The man's son, whose name will not be published in fear of discrimination, told The Observer that his father had indicated to him while in New York that he was feeling weak, that he didn't feel he had much time left, and that he did not wish to die in the United States. The man said he immediately booked 4 tickets for himself, his father, mother, and son, and traveled to the island. The 4 arrived on the island last Thursday, and his father became ill on Sunday. He was taken to hospital, where he died 2 days after.
The case that has demised did have several risk factors. An elderly person with chronic illnesses. And again, we want to emphasize that these are our high-risk groups: chronic illnesses, elderly patient. I also want to emphasize that in terms of transmitting the disease, this is where the contact tracing is important, So in terms of passing on the infection to persons, you realize that based on our contact tracing, we really have had very limited spread, And remember now that even in coming up for patient 1, where we have 5 persons that are positive, we have contacted hundreds of persons. Out of those hundreds of persons, a small subset of persons that have actually had reasonable contact, and only about 20 persons were symptomatic. And those persons have been isolated or quarantined and have been sampled, And most of the tests are coming back as negative.
There have been almost 220,000 novel coronavirus infections worldwide. Almost half that number reportedly recovered. The disease has a mortality rate of less than 5%. An employee of the Ministry of Foreign Affairs and Foreign Trade at the Consulate General in New York tested positive for the COVID-19 virus. She is a locally recruited member of staff born in Jamaica but a naturalized U.S. citizen, and is presently receiving treatment within the U.S. public health system. The Minister of Foreign Affairs and Foreign Trade, Senator Kamina Johnson-Smith, in a statement said, quote, "We had hoped that this day would not come. And in fact, based on the massive overnight increase in numbers in New York State and Manhattan, we had already begun upgrading the protective measures already in place to move to full closure of the consulate," end quote. Senator Smith has approved immediate closure for sanitization of the office and home quarantine of all staff for 14 days. Senator Johnson-Smith says in addition to overseas missions, which had closed consular services to the public on Monday, all others would now be fully closed to the public, with rostered duty and work from home where possible. The head of the World Health Organization, WHO, is calling the new coronavirus an enemy against humanity as the number of people infected in the pandemic soared past 200,000. Worldwide, fatalities number 8,000, and more deaths have now been recorded in Europe than in Asia since the outbreak first emerged in China in December. WHO's Director General told journalists in a virtual news conference recently that this coronavirus is presenting us with an unprecedented threat.
More than 80% of all cases are from two regions, the Western Pacific and Europe. We know that many countries now face escalating epidemics and are feeling overwhelmed. We hear you. We know the tremendous difficulties you face and the enormous burden you are under. We understand the heart-wrenching choices you are having to make. We understand that different countries and communities are in different situations with different levels of transmission. Every day, WHO is talking to ministers of health, heads of states, health workers, hospital managers, industry leaders, CEOs, and more to help them prepare and prioritize according to their specific situation. Don't assume your community won't be affected. Prepare as if it will be. Don't assume you won't be infected. Prepare as if you will be.
He stressed the need for countries everywhere to come together as one against what he described as a common enemy, an enemy against humanity. Sub-Saharan Africa has only recorded 233 cases and 4 deaths, making it the least affected region. But Tedros warned the situation could quickly shift.
We cannot take this number as, the amount of, or the number of cases we have in Africa. Probably we have undetected cases or unreported cases. But in addition to that, even if we take these 233 cases are true, we have to prepare for the worst. In other countries, we have seen how the virus actually accelerates after a certain tipping point. So the best advice for Africa is to prepare for the worst and prepare today. It's actually better, if these numbers are really true, to cut it from the bud. And that's why we're saying we have to do the testing, we have to do the contact tracing, we have to do the isolation, and cut it from the bud. And with regard to mass gathering and so on, it will help if we avoid that.
Tedros said the WHO is speaking daily with decision makers worldwide to help them prepare and prioritize. The WHO has called for every single suspected case to be tested. He urged states to introduce physical distancing measures, including canceling sporting events, concerts, and other large gatherings to slow down transmission. But Tedros added that the only way to suppress and control epidemics of the virus was for countries to isolate, test, treat, and trace.
But to suppress and control the epidemics, countries must isolate, test, treat, and trace. If they don't, transmission chains can continue at a low level, then resurge once physical distancing measures are lifted. WHO continues to recommend that isolating, testing, and treating every suspected case and tracing every contact must be the backbone of the response in every country.
He also said WHO was launching a solidarity trial of 5 proposed treatments for the virus across 10 countries to figure out which was most effective. But an actual rollout of a vaccine remains far off. Locally, opposition spokesman on education Peter Bunting wants a cash transfer to PATH families with children on the school feeding program. Schools have been closed for 14 days since last week Friday.
The suggestion we have is that for all the kids who are on the PATH program, and nutritional support is sent either to Nutrition Products Limited or to the schools for them, it would be better to accumulate 6 weeks of these funds and add them to the PATH checks that the parents would be getting anyway. The families who are on PATH would benefit much more. It would leave them with a lot more purchasing power if they were given these as direct cash transfers rather than incurring the cost, whether by the schools, by ODPEM, by NGOs, to do the logistics of trying to distribute the actual food packages.
Bunting is predicting that schools could be closed for as much as 6 weeks. He points out that given the anticipated extended closure, the funds to provide meals for students on the school feeding program could be more efficiently handled.
If we accept and the government shares that at least 6 weeks is a more likely time frame, then the mitigating factors that the Ministry of Education and principals will put into play will take that into account. So, for example, we have the nutrition in sport for nutrition in schools. The Nutri-Buns and little packets of milk are being delivered to schools now. This provides a significant logistical challenge for the principals, for the administrators to deliver these to the kids. And it hardly makes sense for children to take, especially those who live some distance from the school, to incur the cost of the transportation, to come to school to collect these, when in fact it might be more than the value of the nutritional support.
A moratorium on statutory deductions. That suggestion from the opposition People's National Party as part of measures to deal with the economic impact of the coronavirus. During a news conference Wednesday afternoon, opposition spokesman on finance Mark Golding said he agreed with the government's announcement of cash transfers to certain companies based on the number of employees they retain, as well as the persons who lose their jobs. However, Mr. Golding wants to see more done.
This will assist businesses to keep persons employed, and this would be an additional measure to go along with the two that the minister mentioned yesterday. The statutory contributions are a substantial cost to employers, and a moratorium on those during the period of crisis will assist them to keep their workers employed. We feel that this is a collection of measures that will together help to ensure that the society as a whole is not totally traumatized and doesn't fragment.
Mr. Golding explained that the moratorium would apply to affected employers as well as workers whose salaries have been cut. He also proposed a $50,000 cash transfer to families on the Program of Advancement through Health and Education PATH for 2 to 3 months. Mr. Golding said while the government has waived customs duties on items such as hand sanitizers and masks, the general consumption tax should also be temporarily removed.
We'd also reiterate the call for a rollback of GCT on hand sanitizers, soap, disinfectant wipes, sprays, and other personal hygiene products that are recommended for constant regular use during this crisis. And we would also call for a GCT rollback on the recommended medications, paracetamol and other medications for persons who become symptomatic and need to have these medicines to ease the pain that they will be going through.
Credit rating agency Moody's says Jamaica's large primary surplus and adequate international reserves provide the government with ample support to limit the credit negative effect that travel restrictions will have on the tourism industry because of the novel coronavirus outbreak. In an issued comment released Wednesday, Moody's noted that the travel restrictions will exacerbate the slowdown in tourism and economy. However, the agency said compared with other Caribbean islands, Jamaica's vulnerability to tourism is moderate. While they expect growth to slow from declining tourist arrivals, Moody's says the effect on Jamaica's external accounts will be partially offset by the high import content of tourism earnings, which will reduce the country's import bill. The agency added that lower oil prices will also have a positive effect on Jamaica's current account. The public is being urged to assist the cops in finding a man who they say is a person of interest in the investigation into the disappearance of university student Jasmine Dean. This image of the man is being distributed by the cops. The photo was shown at a press conference called by the Jamaica Constabulary Force in Kingston Wednesday morning.
Ms. Dean, based on our investigation, we have identified that on the 27th of February 2020, about 10:34 p.m., Ms. Dean, based on her cell phone, was in Bull Bay. At 12:19 a.m., we can say that we have evidence that there was movement in Harborview. And at 12:35 a.m., that is the 28th, we can say the last time our phone was on or active was at 12:35 p.m. 12:35 a.m., thank you. And that was somewhere downtown Kingston. Since then, we have not been able to identify any movement in relation to our phone, no calls, etc. were made. But the photograph that we are going to publish is very important because this person is a person of interest, and there are some other vital information, if I may say, that we have that at this time we cannot release to the media.
22-year-old Dean, who is visually impaired, went missing sometime after 10 p.m. on February 27 after boarding a taxi at the Irving Hall gate of the University of the West Indies, Mona, where she is a student. The Passport, Immigration and Citizenship Agency has scaled down its activities in keeping with the government's instructions in light of the outbreak of COVID-19 in the island. PICA's offices in Savannah Lamar, Westmoreland, Morant Bay, St. Thomas and Port Antonio, Portland will be closed for the next 7 days. Passports can be collected at the following locations: Mandeville, Manchester, St. Anne's Bay, St. Anne, Montego Bay, St. James and Portmore, St. Catherine. Just about 700 pounds of compressed ganja with an estimated street value of $2.8 million was seized by the police at Wharf in Kingston. Reports from the Narcotics Division are that police were alerted to a container after Jamaica Constabulary Force's sniffer dogs raised an alarm about 12:30 a.m. Sunday, March 15. The container had a false compartment containing 236 parcels of ganja, which was destined for an address in the United States of America. The police are appealing to anyone who can assist in the investigation to share information by contacting the Narcotics Division at 876-923-457627 or Crime Stop at 311. The US dollar is being traded at $136.54, down by 11 cents. That's according to the Bank of Jamaica's daily exchange trading summary. The Canadian dollar is being traded at $95.42, down from $97.48, while the British pound sterling is being traded at $164.35, down from $164.95. In regional news, Barbados has reported its first 2 cases of COVID-19. Health and Wellness Minister Lieutenant Colonel Jeffrey Bostick updated the nation.
Today, I am advising the public that Barbados has recorded its first 2 cases of COVID-19. The patients are a 48-year-old visitor who arrived in Barbados on March 13th from the United States, and a 39-year-old female, a Barbadian who recently returned to Barbados from the United States. Both patients were experiencing symptoms of a viral infection and were referred to the team at the Ministry of Health and Wellness for further evaluation. The Best Dos Santos Public Health Laboratory informed us early this morning that samples taken for these patients were positive. Both patients are being managed for COVID-19 and have been placed in isolation, where they will remain until they recover. There were among 14 persons tested yesterday. All the others tested negative for COVID-19. Meanwhile, the Ministry of Health and Wellness has initiated the process of contact tracing to identify every individual who came into close contact with these patients. These persons will all be placed in quarantine for 14 days. Our priority now as a ministry is to ensure that COVID-19 is contained and to do all in our power to prevent in-country transmission. We are now at stage 1 of our national COVID-19 preparedness plan, where the primary focus is containment to prevent community spread.
The minister outlined some measures to prevent the local transmission of the virus.
We have decided on the following measures which will be implemented with immediate effect. All public gatherings such as sporting and cultural events or any event that attracts crowds will be restricted to 100 persons. Visits by members of the public to all public and private geriatric institutions are suspended until further notice. Visits to the Queen Elizabeth Hospital are restricted to protect elderly patients as well as those suffering with non-communicable diseases. The isolation center at Enmore has been stood up with 6 isolation beds, and quarantine facilities are in place at the Paragon Base in Christchurch and the Elaine Canterbury Center, River Bay, St. Lucie. Additionally, quarantine and isolation facilities will be available at Harrison's Point within weeks. The Barbados Defense Forces Field Medical Facility has also been set up to provide additional screening, quarantine, and isolation services. I wish to reiterate that our mission now is to prevent the spread of this viral illness in our country. We must all play our part by being vigilant about putting into practice the public health advice that you must now be very familiar with. Wash your hands frequently and thoroughly with soap and water. Alternatively, use an alcohol-based hand sanitizer. Practice social distancing, that is, maintain at least 1 meter or 3 feet between yourself and anyone who is coughing or sneezing.
Over in Guyana, President David Granger has expressed disappointment with the withdrawal of 5 members of a high-level observer team to oversee the recount of votes in the recent March 2 elections. More in this report from InfoHub in Guyana.
The independent high-level team is chaired by the former Attorney General and Minister of Foreign Affairs of Dominica, Francine Barron, and comprises of former Minister of Finance of Grenada, Anthony Botswain, Senior Lecturer in the Department of Government of the University of the West Indies, Cynthia Barrow-Giles, Chief Electoral Officer of Barbados, Angela Taylor, and Chief Elections Officer of Trinidad and Tobago, Fern Narcissus Scope. President Granger noted that the initiative was embraced as it was based on an understanding that a recount of the ballots cast at the March 2, 2020 general and regional elections would be executed. The initiative saw the arrival of a high-level team of 5 distinguished Caribbean professionals to oversee the process. The team, unfortunately, was unable to commence its task. The Supreme Court of the Judiciary granted an injunction filed by a citizen on 17th of March 2020, thereby preventing the Elections Commission and its agents from proceeding with the total national recount. End of quote. According to the head of state, the court action has curtailed further the trust towards reaching a transparent conclusion to the 2020 general and regional elections. The matter will be heard in the Supreme Court on March 20, 2020. President Granger maintained that he will abide by the decisions of the court and the Guyana Elections Commission. He stated, quote, "I iterate my commitment to the due completion of all electoral requirements and the conclusion of the process under the auspices of the Commission and in the interest of all Guyanese. I assure the nation that I remain committed to the electoral process and to the declaration of results by the Elections Commission in accordance with the law." End of quote. For InfoHub, Anara Khan.
In sports, we bowl off with cricket. The West Indies series against England could be held in the Caribbean instead of in England as originally planned, as both Cricket West Indies and the England and Wales Cricket Board try to find a workaround amidst the COVID-19 crisis. The sides are scheduled to play 3 tests in England, with the first due to start at the Kia Oval on June 4. Reports say the CWI and ECB have held several discussions in recent days with the options under consideration, including the possibility of rescheduling the series. It is also understood that CWI have offered to host England's 3-test series against Pakistan, scheduled to start on July 30. England are also scheduled to host Ireland for 3 ODIs in mid-September. The Olympic flame is traveling alone. A special charter aircraft departed Tokyo, Japan on Wednesday to collect the Olympic flame in Athens, but has done so without a delegation from Tokyo 2020 on board. Triple Olympic wrestling gold medalist Shoei Yoshida and 3-time judo gold medalist Tadero Namura had been due to participate in Thursday's handover ceremony at the Greek capital, but Tokyo 2020 made a last-minute change as a precaution against the spread of the coronavirus. And Spanish Olympic Committee President Alejandro Blanco wants this year's Olympic Games in Tokyo to be postponed because his country's athletes are not able to train due to the coronavirus pandemic. On Tuesday, the International Olympic Committee said there was no need for, quote, any drastic decisions at this stage, end quote, in relation to Tokyo 2020, despite the sporting calendar having been severely impacted and several Olympic qualifiers and World Championships being postponed or cancelled. The opening ceremony is due to take place on July 24, but Blanco believes it would be unfair for the Olympics to go ahead as planned. And that's the news on PBCJ. Remember, we are the People's Station.